My name is Todd Palm, and I'm an independent member of 7K Metals. And one of the benefits we have is of the health plan that they offer. So, what I'm about to do is show you a presentation on the health plan. So, this is the 7K health plan, and it's a benefit of joining 7K Metals. And once again, my name is Todd Palm. I'm the presenter. And I have all kinds of experience on the health plan side. So I understand commercial plans, Medicaid plans, and Medicare plans, and I've been doing this for over 30 years. And I've been self-employed since 2009 as a healthcare systems consultant. And I've helped 4 different health plans implement the Patient Protection and Affordable Care Act, which you know by the short version of Affordable Care Act or Obamacare. And in the industry, we know that as PPACA. I've implemented, taken either the state contract for Medicaid, an individual contract for commercial, or CMS regs for Medicare, and configured the benefits and the pricing for that, so that when doctor submits a claim, it pays like it's supposed to. I've also implemented HIPAA, Sarbanes-Oxley. That was a financial reporting rule that came out not long after Enron, and it had some civil penalties associated with that if financials weren't being reported properly. Remember in 1999 when everybody was scared the computers were all going to die, and as soon as the clock struck 12 in the year 2000, that was Y2K. That was where all computer systems had 2-digit years, and I ran updates to a lot of those to change those years to 4-digit years. ICD-10, I helped the health plan implement that before the government actually finally said, yeah, we're going to go to that because they kept delaying it over and over and over. That's the International Classification of Diseases, version 10. All the diagnosis codes, there were about 20,000 diagnosis codes in ICD-9, and that went to about 160,000 diagnosis codes in ICD-10. Those it went from very general to very specific. I implemented some Medicare Part C EOBs, for a health plan, and the Medicare Diabetes Prevention Program. I configured all that. So, just from my experience here, when it comes to healthcare from the payer side, I definitely have a lot of experience there. So, I'm going to give you an overview of the 7K health plan, which is a benefit that you have once you join 7K. And it's available to anyone who joins 7K, whether you get the $199 package or the $499 package. And you don't have any other qualifications to join. Well, you have to be under 65. That's the only qualification. Because when you're 65 or older, you're eligible for Medicare. So you don't have to reach a certain rank or have a certain amount of volume. And it is a viable alternative to the PPACA plans. Remember that, Obamacare? That's those plans that are available on healthcare.gov. And it meets and exceeds the minimum essential coverage guidelines under the law. That's known as the MEC. And it's ERISA compliant. Every health plan has to be ERISA compliant. And it's administered by free market administrators. So even though it's the 7K Metals offering, it's administered by free market administrators. So they're partnering with 7K. There's prescription drug coverage. That is by ServU RX, and they're the PBM, that pharmacy benefit manager. The doctor, hospital, ER, those are providers, and they use the PHCS nationwide provider network. There are no pre-existing condition exclusions. There are no deductibles. there are annual maximum benefits, and this is what keeps the premium cost low. You get unlimited in-network primary care doctor visits for just a $10 copay each time, and an unlimited urgent care visits for a $25 copay each time. Preventive care is at no cost, and it's considered preventive when you go in without any presenting symptoms, right? And you get your preventive care. That's at no cost, and what the doctor charges for that, what's billed for, does not roll up to the annual benefit limit. And in addition to healthcare, there's a dental and vision discount plan, and that's administered by Carrington. For the healthcare, there are 3 plans available: plans A, B, and C. And Plan A has an individual maximum yearly benefit of $10,000 and a family yearly benefit of $20,000. There is an out-of-pocket max each year also. As an individual, you won't pay more than $5,000 out of your pocket that year. And as a family, you won't pay more than $10,000 out of pocket because the coinsurance is 50%. So 50%, you're not paying 50% of whatever the doctor bills, because the doctor has contracted with free market administrators to a fee schedule, right? So you go to the doctor, you submit the claim, you get the bill after that, it's much smaller. Your 50% is going to be what they agreed to, not of what they agreed to. And that rolls up to your annual out-of-pocket max. Plan B is double the annual maximum benefit of Plan A. So it's $20,000 for an individual, $40,000 for a family. The individual out-of-pocket max, you'd think it would be double, right? But it's not. It's $7,000. And the family out-of-pocket max is $14,000. That's because 50% coinsurance is on the first $10,000, but the second $10,000 of the $20,000 is at 20%. So that's where the $7,000 comes from. Plan C is essentially the same as Plan A, but individuals have an additional $25,000 in enhanced benefits. Families have an additional $50,000, for the family coverage of $50,000. The out-of-pocket max is the same as Plan B. And these extra enhanced benefits are for inpatient hospital, outpatient surgery, and professional services. The vision and dental discount plan is included at no additional cost, and it uses the Carrington Point of Service, that's POS, Point of Service Dental Network, and they give you a provider lookup tool, and it's a large network, and there's a good chance your doctor, your dentist is in there, and if not, you can nominate your dentist to join. They have the option of joining or not, but you can still nominate them if you really want. There's a dentist that you really want to go to. VSP is the vision provider, and you get the savings pass with VSP. And there's LASIK also. You get an $800 savings on custom LASIK through LASIK Plus. And you also get free enhancements for life. Once you're a customer for life for free, and you get a free LASIK exam. And this is an example of some of the dental savings through Carrington. Now, a typical dental visit may be an adult cleaning with a routine checkup and maybe 4 bite wing x-rays. Together, that would be $130. So lots of times people don't want to go to the dentist because you don't know exactly what the cost is going to be out of pocket, right? And where this differs from dental insurance typically has a $1,000 or a $2,000 annual limit. With a savings plan, you can exceed that coverage. So, if you have a lot of dental work that needs to be done, most insurance plans would stop covering it after $1,000 or $2,000. And here you can exceed it. VSP benefit includes a $50 copay for eye exams. So if you go and get glasses also in the same place, then it's a $50 flat rate for the eye exam. The glasses, they have special pricing on those, and it's a lot of the name brand frames and lenses that you've heard of. The glasses I'm wearing now are Nikes. I got those through VSP when I was paying for it individually, and they're really good. If you need contacts, however, you get 15% savings on the exams, but you're on the hook for all the other contact materials. You do get unlimited use on the materials throughout the year. And this is where this differs from the individual plan that I was paying for, because I could only use that one once every 12 months. And just to show you, this is not available in Washington and Vermont. And here's some of the premiums. Now, if you're covered from an employer plan, where the employer, your employer is paying a percentage of what your premium would be, this is really aimed at people who don't have insurance, or people who lost their employer coverage, or people who are self-employed. And this is another option for you. So $254 for the $10,000 plan A for an employee only, all the way up to $561 for family coverage. And then if you're 50 to 64, $277 all the way up to $629. The plan B, you would expect it to double that because there's double the limit, right? But that's not actually double. Just an employee only, 18 to 49, is $313 a month. And it goes all the way up to a family coverage of age 50 to 64, $836 a month. Plan C is the one that I selected. That's where you get those additional enhanced benefits. So I'm in the 50 to 64 age group, and that cost right there is $1,048 a month. And that, for me, solved a big problem, because what I was paying for one of the Affordable Care Act plans, plus dental and vision separately, this $1,048 is less than half of that. So for me, it was a no-brainer to pick this one. Now, there are also catastrophic benefits, and this is your insurance against against a diagnosis you didn't expect. It's also insurance against the low annual benefit limits of plans A, B, and C. There is, however, a pre-existing clause, and that says if you've been treated in the last 12 months for one particular diagnosis, there's a 6-month waiting period before you can use the catastrophic benefits in the health sharing program. What this lets you do is you can share $150,000, $250,000, or $500,000 of your large bill that you didn't expect, from that diagnosis that you got. And that's for a small monthly contribution amount. It's not actually a premium. It's actually a contribution amount that you can select when you sign up for the health plan. And that contribution amount, you're joining in with other members of the health share plan that are paying for other members who've submitted their claims on the health share plan. You're responsible for the first $20,000 of the amount that you share, right? So let's say you have a $500,000 bill that you want to share with all the other members to help pay for it. $480,000 of that will get paid. And you're only on the hook for the $20,000. I think that's a pretty good deal. And this lays out the limits, like I just explained. And you'll notice there's a lifetime sharing maximum. So if you share $500,000 one year, you can do it again another year, and then you're done. Hopefully you don't have any more big claims after that. And these are the breakdowns for the sharing amount. These are the monthly contributions. So it's as low as $104 for a member in the 18 to 39 age range, up to $282 for a family in the 60 to 64 age range. And this is for $150,000 of billing that you want to share. For $250,000 of billing, it ranges from $179.16 for an 18 to 39-year-old member, up to $382 for a family in the 60 to 64 age range. This is where the primary member is in that age range. And I'm in the 50 to 59, and I picked the 352. So remember, I was spending $1,048 for the health plan. I'm adding 352, which comes out to an even $1,400. That is still saving me almost $900 a month over what I was paying previously. And that was without a catastrophic plan, right? And this $500,000 one is as low as $198.17 for one member, for an individual in the 18 to 39 age group, and as much as $425 for a family in the 60 to 64 age range. There's more. You can offer the 7K health plan to employers with more than 2 employees. Because if it's just one employee, that's you as an individual. You can get individual insurance. Now, for the catastrophic plan, that requires a license, and you can refer them to the experts at SBA Co-op. When you have a link that is unique to you that you can share with employer groups. So if you know companies that don't offer insurance to their employees because it probably got too expensive, especially during this whole pandemic, or if people who are out of work or in who need insurance, this is a good option for them. Now, there's a link in your back office, and I'm going to show you how you find that. So once you log in to your 7K site and you click links on the side, it'll show you this one, and you pick the 7K health group and click check it out. And when you get there, in your address bar at the top will be a unique address. Copy that, save it in your phone as a note or something like that. That's your link that you can give employers. So if you know someone, you can say, hey, check this out. Here's my link. Go get a quote. See if this is for you. And there's even more. You get paid on this. So your health plan will generate points for your team, and it'll create cycles in the compensation plan, just like the medals do. Individual plans create 15 points. Family plans create 20 points. And this is even better than it looks, because the health plan is one product. The catastrophic plan is another product. So you can generate every month as much as 30 points if you have both products as an individual, or as much as 40 points if you have a family plan. So this is one of the best things, and it's a benefit of joining. So if you have any questions, get back to the person who sent you this, and they'll be happy to get your questions answered. This is Todd Palm. I'm signing off.